Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Dania Reynolds. In this episode, we focus on considerations regarding weight gain with various antiretroviral regimens. Which agents are most likely to cause weight gain? What do the guidelines say about management of weight gain due to ART? To answer these questions, I'm joined by Dr. Daniel Kuritzkes from Harvard Medical School and Brigham and Women's Hospital in Boston, Massachusetts. For more information about Dr. Kuritzkes and this program, and to follow along with the slides, please visit the links in the show notes for this episode. Now let's get started and hear what Dr. Kuritzkes has to say about weight gain with antiretroviral therapy.
Paul Sachs, who analyzed pooled data from 8 clinical trials looking at weight gain in participants randomized to receive an INSTI, a PI, or a non-nuke. And as you know, the weight gain was greatest with the INSTIs, but then teasing that out further, weight gain with bictegravir and dolutegravir was comparable and greater, significantly greater than in a boosted elvitegravir regimen. And when differentiated by the companion nucleoside RT inhibitors, you can see that weight gain was greatest with TAF, least with zidovudine, and somewhat greater, but still significantly lower than for TAF with TDF or abacavir. These data were similar to what was seen prospectively in the ADVANCE study, a randomized trial that compared dolutegravir versus efavirenz and TAF versus TDF. And the data are broken down between men and women. And you can see that overall, women gained roughly twice as much weight as men. The weight gain was greatest in those receiving dolutegravir FTC TAF compared to dolutegravir FTC TDF, and least among those receiving the efavirenz regimen, which was together with FTC TDF. The characterized study looked at weight changes after switching to a dolutegravir 3TC TDF regimen. This is a study that has been published in Clinical Infectious Diseases. It was a 52-week follow-up for patients who had previously been in the ADVANCE study, which we just reviewed. And so they switched from one of these 3 regimens to dolutegravir 3TC TDF as a fixed dose single tablet regimen. For those who had previously been on FTC TAF, they showed a decrease in weight. And for those who had previously been on an efavirenz based regimen, which included FTC and TDF, they showed an increase in weight. You can interpret that as either meaning that dolutegravir causes weight gain and that TAF had caused weight gain, which was then reversed on TDF, or you could explain this as efavirenz somehow suppressing weight gain, which then occurs when you remove the efavirenz, and that TDF is responsible for weight loss. In the Gemini studies, which looked at dolutegravir 3TC compared to a 3-drug regimen, you can see that there was a lower risk of drug-related adverse events in the 2-drug versus the 3-drug arm, but there was more weight gain in the 2-drug arm versus the 3-drug arm, again, most likely because of a weight suppressive effect of TDF. Here, there's no TAF in the study. So what do the DHHS guidelines say about weight gain? They note that significant weight gain can occur with all regimens, but appear to be more pronounced with the second-generation integrase inhibitors and with TAF. And there are lifestyle and diet changes that can help to mitigate that. Weight gain should be considered a factor when selecting ART, especially in Black women. And it remains unclear whether a switch to a non-INSTI-based regimen results in reversal of the weight gain, and the underlying mechanisms for this weight gain and their effects on other health problems is really unknown at this time. I should point out that there are data posted on clinicaltrials.gov of a study in which people on an integrase inhibitor-based regimen were switched to doravirine and islatravir, and that study showed no difference in weight compared to those who remained on their integrase inhibitor-based regimens. Those data have not yet been presented, but they are publicly available on the clinicaltrials.gov website.
Thank you very much to Dr. Kuritzkes, and thank you to our listeners for joining in. As a reminder, to view the full Contemporary HIV Treatment and Prevention 2023 program on the Clinical Care Options website, and to access the slide set for Individualizing ART, What Do Patients Want?, click on the links in the show notes for this episode. And please be sure to check back regularly for more episodes on important infectious disease topics. Thank you.